Hi, my name is Joanne Bogwa. I'm a clinician. I work for Good Life Pharmacy. Today we are going to talk about cardiovascular diseases or issues. These are diseases that affect the heart and the blood vessels. Examples are hypertension, heart attack, heart failure. The common risk factors include unhealthy diet, physical inactivity, genetics, obesity, and smoking. Management and prevention of these diseases include lifestyle modification, regular exercises, smoking cessation, and eating a healthy diet. At Good Life Pharmacies, we offer a wide range of services to support your cardiovascular issues. This includes BP monitoring, sugar monitoring, servicing your prescriptions offered by your doctor, and nutritional counseling.
Thank you so much for tuning in to Health and Wellness tonight. My name is Zaitun Ali and we're coming to you from the Fairview Hotel right here at Bishop Road, Upper Hill. And on today's episode, we are going to talk about the congenital heart disease. So this one occurs during the first 8 weeks of pregnancy when the baby's heart is developing. And it means that some of the structures do not develop as expected. But on set, we have Dr. Primanad Ponoth from KTN Hospital. He is a surgeon, and also Dr. Anthony Gikonyo, an adult cardiologist. And we have a survivor of this condition. She's called Glory Joy, and they will let us know the experience and how the treatment looks like. And also on the second part of the show, we'll have our audience building in the conversation and also having time to ask the experts here questions about this condition. So welcome to the show. Karibuni sana.
Thank you.
And I will really want to start with you, Glory Joy. So because it is an amazing thing to see you here, very healthy and strong after going through this condition. So maybe let's know your experience. How was it for you? How did you realize and get diagnosed with this condition?
Started having very funny palpitations, a lot of dizziness, congestion in the chest. So whenever I would go to the hospitals, it would be maybe I'm having a cold, I'm having the upper respiratory diseases. That is what I was being treated for, a lot of antibiotics. And then now in my mid 30s, that's when it got worse. And one day when I went for treatment, the nurse noticed that my blood pressure was very low and my heartbeat was also very low. And then now she referred me to a cardio. That's how I found myself at the KTN Hospital.
Okay.
Yes.
And perhaps Dr. Anthony, being an adult cardiologist, so does this mean, since it's detected from birth, does it mean she's been living with it all through the 30 years with maybe less severe symptoms? And how do you treat such a case?
So I think in her case, in Joy's case, the issue, it's most likely something she got when she was an adult. So it's not something that she was born with. The symptoms are, as she's described, some difficulty breathing, fast heartbeat, not being able to do your usual activities. And luckily she had a good nurse who was able to detect the basic findings and then refer to a heart specialist, which is what myself and Dr. Prem are.
Okay, and maybe you can explain the relationship between now you as a surgeon and you as an adult cardiologist in terms of treating this condition.
Yeah, for any heart ailment, or rather for any ailment, if you have a team approach, that's the best way to do it. So what we have is called a heart team in KTN Hospital, where there's a cardiologist, there's a surgeon, there is an anesthesiologist, and then the associated people. So any patient who comes, we approach as a team, so that we analyze what is the problem, lay it on the table, all the cards, and see what's the problem, how to deal with it. And for her case also, that was it. We did the initial investigation. Anthony has done the initial investigation like ECG, echo, all sort of things, blood tests, everything. And we came to a conclusion that this is what she has. And then once we have it, then what is a cafeteria-like choice. You go to a cafeteria, there's a lot of things on the menu. So for her, we, 1, 2, 3, 4, 5, this is the problem and this is the best option. So we explained to her that you have this problem and this is the best treatment for you.
And being able to actually give this diagnosis, what would you say cost, especially her condition?
So most of heart disease in Kenya is related to rheumatic heart disease.
Okay.
And that's why we have the Heart to Heart Foundation, which I guess we'll talk about later. And most of this is preventable in the sense that you'll have in early age, you'll get an infection of a throat infection. And unfortunately, that your body's reaction to that will lead to inflammation of the valves of the heart. And then eventually, as you grow older, then you get the symptoms that we were discussing. And this is preventable if you catch the infection early and give antibiotics.
Yeah. So you're trying to say these sore throats that we normally have and we ignore, we just take the azithromycin and that's it. It might lead to such a condition.
Yes.
Yeah.
Okay.
So it's good to be vigilant, go see your doctor early, not to just discount this or take the azithromycin over the counter.
Yes.
But this is particularly important for children.
Yeah. For children, and especially, maybe let me talk to you, Dr. And for those who are born with it, they might get it from maybe parents, their mother may be having the diabetes, like I said, or being obese. So maybe explain those conditions. Yeah.
So there is a condition we generally called as congenital heart disease.
Okay.
Congenital heart disease is a term by which a child is born with a heart problem.
Yeah.
There can be many. Broadly, you can classify as a cyanotic and acyanotic. Cyanotic means the child is bluish. Whenever the child cries or whenever the child is running around, it turns blue. Sometimes it's called as a blue baby syndrome. The other one, child runs around, not much of issue, sometimes a little bit of breathing problem. And one of the common complaints the mother says is that the child can't catch up with other children,
Okay.
He gets puffed up or she gets puffed up pretty fast. So that you can broadly classify into two, cyanotic and acyanotic. That's the basic. So when a child is born with it, many times, it is missed.
Yes.
Unless the child has got very predominant problem. Like I told you, the milestones for a child is not proper. All the children are putting on weight, growing, this child is not doing. So that's a milestone, number one. Number two, sometimes the mother comes and says that whenever the child drinks milk, become breathless, bluish coloration, or repeated respiratory infection. The mother always says that child is getting cough and cold all the time, every month. So that is a warning sign. So delayed milestone, repeated respiratory infection, child is getting tired or puffed up pretty early because she can't run around with other children, or turning blue when they exert. All these are warning signs. They are all red flags. The moment the mother finds it, I think my advice is go to a good doctor, get it checked. Because there's something you are missing.
Most of the parents are cringing because the toddlers come home with colds every time they've opened school. So we need not to ignore that.
Yes.
And for you, Joy, especially when you found out, take us through the treatment. How has it been for you? Are you still undergoing treatment? And what was it like for you?
It was very scary, especially when I went to the KTN hospital. I had all the tests done, and then the doctor sat me down. I had like 7 doctors sit me down and explain to me what was happening and what they will do in future. And when I met Dr. Gikonyo, he explained to me at some point we will have to do a surgery so that we can correct it. And you will not be the first one.
Yes.
We have done it before and it will be well. Of course, there was that comforting, but of course very scary.
Definitely.
But I think we had a journey of like 6 months where I was on medication, going to see them every 2 to 3 weeks. And then after that, I think in December when he did one of the heart tests, he found out that the heart had started enlarging because it was leaking. It had started enlarging, and he told me that we needed to do the surgery at least by end of that year.
Okay.
So they prepared me again for open heart surgery. And it's very, very scary, of course. But at least you when you go to the hospital, you meet other survivors. Yes. So at least you're able to pull through. We had surgery. I had surgery on I think on a Monday. By Thursday, I had woken up. I was walking.
This was which year?
2019 December.
Okay.
Yeah. By Thursday, I had started walking. So you see, there's hope. And of course, I was on a lot of medication at the beginning after surgery. But within a span of around 3, 4 to 6 weeks, I had shed off the medication to only one, which is a blood thinner, which I am still taking up to today.
Okay.
So the journey of healing, I can say the first 2 to 3 weeks after surgery is a bit tough, but after that you pick up your life. So people, don't be scared of going to seek medical attention.
Okay.
Yeah.
And Dr. Kikonyo, how was it for the treatment, especially after? Let me start with before. How do you prepare someone before getting now the treatment or maybe going through the surgery?
I think it requires a lot of trust from the patients.
Yes.
And, that the team that we have can do what we're saying we can do and do it safely. And so we spend a good amount of time talking to the patient, talking to their family, introducing them to other people who've had the surgery.
Yeah.
And that brings us to a point maybe we'll discuss later, which is now we've created a support group so that people join that support group early on in the journey so that they can meet other people and ask questions that perhaps we as doctors aren't able to answer. But it's just explaining what the problem is, explaining what our statistics are as far as successful surgery, and then understanding that this is a long-term project. Things will go well. There may be some setbacks, and
Yes.
accepting that those setbacks will happen whether you're here or anywhere else in the world with this surgery, and always having open lines of communication with the surgeon, with myself. We have a cardiac coordinator. We're now trying to get a social worker. We have the support group. All those things help make sure that the person understands what's going on. And of course, there's always a financial aspect.
Definitely.
Yeah, and we're very happy with the National Health Insurance Fund for being able to chip in.
Nowadays
yeah.
it can cover?
It can cover almost a third.
Okay.
Yeah, but of course, unfortunately, as the prices of certain consumables have gone up, then what they're able to cover is less. But those are the things that hopefully through advocacy we'll be able to address. But it's helped a lot of patients get access to surgery within the country.
That's good. I can see you have a prop over here, Dr. Prim.
Yes.
And I know you're the surgeon. Maybe you can explain to us how the disease affects
Yes.
the heart and what you normally do during the surgery.
Yeah.
Yeah.
So for her, I'll take the example of hers.
Okay.
So this is the heart. The size of the heart is broadly like as big as your fist.
Okay.
So whatever your fist, that's the size of the heart, a normal heart.
Mine is too small.
Yeah, well, then it's a small heart. So heart is it's muscle. It is pumping. Ever since you are born till you die, it's working. So it's it's an organ which works without any rest.
Okay.
As you know, any organ needs food. For the heart, the food comes through the blood, and they are called the coronary arteries. You see the blood vessels here. There are two of them, just like your left hand and right hand. One on the left side, one on the right side. And the left supplies the left side of the heart. The right supplies the right side of the heart. That's
Okay.
Now, of course, we are seeing some lifestyle changes in Kenya, maybe because the financial and living conditions have become better. People started taking a lot of junk food, greasy food, all sort of things. So because of the cholesterol and tension and diabetes and all sort of things, in the present world life, we find a lot of blocks in these arteries, which is known as coronary artery disease, and that is what is causing heart attacks. And we do what is called angioplasty with stenting, Anthony does it, or I do bypass surgery.
Okay.
So that's one issue, adult problem. Now what you are talking about, the congenital problem, inside the heart, as you know, there are 4 chambers. There are 2 upper, 2 lower. It's the left side, this is the right side. The blood flows from the left upper chamber to the lower chamber, and there is a valve. It's like the door in your house. It will allow blood only to come down from the top. And from here, it goes, from the left side, it goes through the aorta, which is the main pump blood vessel in the heart. Here is the head, left hand, right hand, it goes down to the legs and all the organs.
Okay.
So this is the basic anatomy. And from the right side, the blood, impure blood, comes from here, pumps through what is called the pulmonary artery into the lungs, it gets oxygenated, come back. So from the right is full of impure blood, left is full of pure blood. So you can say it's a bright red and bluish color, So from here, it goes into the lungs, get purified, come to the left side, again pump to a different part of the body. Now what she had, see, at the entry of these 2 blood vessels, there is a valve. Once again, like a door in your house.
Okay.
It will allow blood only to go one side. Now for her, the door or the valve right at the beginning of it, it's called the aortic valve, was leaking. What I mean to say leaking, blood goes there, but it comes back again. You see?
It comes down. And
Comes down because it's not closed. Think of a door in your house, it's not closing well. So it's going up and down. So that causes this chamber to get dilated, number one. And also, it also caused this artery to get dilated.
Is it the thing that she was saying now the heart was swollen?
Yes, yes.
Or it's because of the down?
Yes. You know.
Okay.
So people in layman say the heart is swollen, dilated, you know, all sort of things. So it's because the valve is not working well, that is one. And also this blood vessel was dilated. We call it aneurysm, you know.
Okay.
Aneurysm is a term that the doctors use for the dilated part of it. So there was aneurysm of the aorta as well as this valve was leaking. So this was causing the symptoms for her. She was feeling breathless, she cannot walk
Palpitations,
fast, palpitation, breathing problem, all sort of things were there. Okay. So that is what we diagnosed with, you know, all these echocardiogram, ECG, X-ray, you know, all sort of tools. And we pinpointed and told her that this is the problem, what's happening. And unfortunately, there is no medicine, magic pills where you take it and say you are okay.
So this it has to be surgery.
So we told her. So any person you say open heart surgery, it takes a little time for them to digest it.
Yes.
You know, go back to the family, talk to them, and accept it and come back. So I think that's a time we give for everyone for them to cool off. You know, it has to imbibe, it has to go into the brain. They have to accept the reality before they come to the next stage. So that's what she did. So we told them, of course, initially it's a shock for anyone.
Definitely.
Yeah. But, you know, over the period of time, they accept the reality.
But the thing is, everyone thinks this is a deathbed. Once you are diagnosed with any heart condition, that's it for you. So maybe you can destroy that narrative.
There was a time, that reminds me, when I was a student, when I was training for cardiac surgery, the mortality was very high. So much so that people used to write the death certificate before the patient goes to the theatre. I'm telling you the reality. Only the date and time they put it, leave it. So that they know when they go, they will come only in the coffin. That used to be the time. But things have changed. Now the technology has advanced.
But I'm telling, it's because you're even here to tell your story to the people. Because before that, I was even asking Daktari, is it a lifelong condition that one has to live with it and until their deathbed? But clearly it's not. After we are taking a short commercial break, and we want her to tell us about how it has been, especially after the surgery. And also the audience will be part of the conversation. They will also have time to ask questions and also give their experiences on what conditions they've had based on the heart conditions as well. So don't go anywhere, stay tuned. This is Health and Wellness. Welcome back. This is Health and Wellness Show. My name is Zaitun Ali. We're coming to you from the Fairview Hotel right here at Bishop Road, Upper Hill, and we are talking about the congenital heart disease. Remember, we have Dr. Prem, who is a surgeon from KTN Hospital. We also have Dr. Gekonyo, who is an adult cardiologist from KTN Hospital as well, and a survivor of this condition, that is Glory Joy, and they've discussed about it, given their experiences and the treatment and how the surgery looks like. So if you have any questions, remember to catch us on our social media handles, that is at KTN Home on all our socials. Also, the SMS line is 22151. Let us know the questions that you have. And we have our audience right here on set. Karibuni sana. Looking forward to engage with you. Yes, so before we went on a break, we were talking about how the treatment was looking like for especially you, Glory. And I would like to ask, so post the surgery, what are some of them, maybe what support have you gotten from people, family, and how has it been getting back to your normal occupation? So how has it been, the journey after the surgery?
After the surgery, you have to be very intentional because, it's already there. So you look for people who are close to you, and my family was very close to me. My mom was very close to me. My friends were very close to me. My church guys were very close to me, and I was very close to the doctors, because you need support from all angles. I would call Dr. AK to tell him I am feeling like this, and he would tell me it is very normal. Yeah, if you're not able to sleep, it is very normal. After maybe a few days, this will change. So you need people around you. You need that love. You need to feel, and also you need a lot of support, people to help you around, because you're not able to do much. Yeah, the first 3 weeks is it's a bit tough.
Dr. Anthony, you had mentioned about a support group that you guys offer at Karen Hospital. Maybe talk about it.
So we've just started it this year now. I'll hand it back to Glory Joy to continue.
Yeah.
But we realize that there are certain questions that patients find it difficult to ask doctors, or there's certain information that as doctors we're not aware of what patients go through either before, during, or after. And we felt that if people who've had the surgery talk to people who are going to have the surgery, or talk amongst themselves, then would provide some more support that we don't get a chance to within the, say, half an hour that we spend with clients or patients in the clinic.
And also for her, if she's maybe looking to, for Glory, if she's looking at getting a family or already has a family, a lot of people ask, is it genetically inherited?
So the majority of disease is not genetically inherited. It's something that you either you acquire in childhood or during the pregnancy, and that's why the government's push for free maternal health care is extremely important, so that everybody has access to a doctor who's an obstetrician and also a pediatrician, so that the normal screening can be done, the normal vaccinations are provided, and the supplements required are given during pregnancy to prevent this occurrence. And the other thing is that if it's found, then early detection is important, so early treatment can be provided.
So for her, she cannot pass it to the other generation?
No.
Okay.
No.
Okay. Dr. Prem, what are some of the things that especially expectant moms can avoid doing so that they cannot pass this to their babies?
During pregnancy, it's the first 3 months they have to be careful.
Okay.
Does not mean that rest of the period is okay. They have to be more careful, because it's the first 3 months where the child in the womb develops the organ, so that's called organogenesis in a doctor's term. So I think that's the time they have to be extra careful not to get any infection, or whatever medicine they take, they should take it with the doctor's guidance. They should not take anything just across the counter. They should not do alcohol or drugs and things like that.
Okay.
So those are the basic things they have to go and meet the obstetrician and take the guidance. So I think once they cross that period, I think the major problem is over. But of course they have to be careful.
Yeah.
And the diabetes or hypertension, whatever they develop, a mother develops during the time of pregnancy, everything has to be tackled properly to have a healthy child.
Yes.
Sometimes if you are not very careful, and that is where the child being born with some congenital problems, as I told you. It may be very simple from a hole inside the heart, or what I told you, like a PDA, an abnormal connection between the aorta and the blood vessel in the lung.
Yes.
To major complex problems. There can be very, very complex problem by which sometimes, I'm just telling you, maybe the child needs a transplant even, because the heart is so malformed that even a surgery cannot help.
Okay.
So that's like a rainbow, from very simple to very complex.
Okay.
It can be there.
So early detection really
is
helps.
very important.
Yeah.
And now the science and technology is far advanced. I'm not sure about Kenya, but in a Western world they do what is known amniotic fluid assessment to find out whether the child in the womb has got any problem, all sort of things. They diagnose it well ahead of time.
Can an ultrasound also show that?
They can. If the guy, it's called fetal ultrasound examination. It's a new technology and a new branch which is being developed, or it is coming up, where people are specialized in doing the ultrasound for the child who is already in the womb and trying to detect if there is a problem. And there has been some conditions, that's a new branch which is called fetal heart surgery, whereby you do surgery when the child is already in the womb.
Okay.
It has been found that sometimes you treat these patients or children who are already unborn children which is in the womb, they come out as a healthy child. So that's another new specialty which is coming up,
Yes.
whereby you take the baby out of the mother's womb, do the surgery and put it back and let the pregnancy to proceed normally and have a normal baby.
We hope it
So-
will be readily accessible
Yes.
and affordable as
I
well.
know. It sounds very simple, but it's very complex.
I know, yes.
So these are some of the way that science and technology is progressing, the diagnostic tool and the surgical tool. The bottom line is that you want a healthy baby.
Okay.
You know, so it's better to fix it early rather than let the child, come out of the mother's womb as a, with some defects and then trying to fix it.
That is true. Dr. Anthony, have you been in a position whereby there was a transition from a pediatric cardiologist now to you, whereby a young person had this condition and now it's transitioned to adulthood and you had to take care of it?
Yeah, we do. Yeah, because more people are getting surgery earlier.
Yeah.
They're surviving and they're doing well and coming to become adults. So we do have a number of patients in that situation, and we're going to see more of those because now we have a full cardiac team.
Yeah.
It includes a pediatric cardiologist, and we're doing more procedures, and we're actually moving not away, but incorporating ways of not having to open somebody up and still treat those procedures.
Yeah.
And that shortens the time in hospital, and also the recovery time is much faster.
Okay, that is fine. So let me throw the question to the side of our audience. I don't know who will go first, who has a question to, okay, you can say your name.
Thank you for the opportunity. I'll have a question for Joy. So, how was your mental status? Maybe during the diagnosis, after the surgery, until now.
What's your name kindly?
I'm Maureen Jerigesheha.
Thank you, Maureen, for your question. Joy, you can let us know in terms of the mental wellness and well-being. How was it for you?
At the beginning, I was very scared. I was very stressed. I was confused. I didn't know what to do. But meeting the team at the current hospital, and they took me through the process, and there was a lot of talks, there was a lot of counseling, there was a lot of therapy, there was a lot of support from the doctors. I think I started gaining courage, and then meeting people who have gone through the same kind of surgery. I started now, getting back to myself. By the time I was going through the surgery, I think I was strong enough. And then, of course, after surgery, you're not in pain, but you're not yourself. So it's like you're not very stable again. But within some time, you continue seeing your doctors. You start doing your daily chores. You get back to yourself. So I can say it's both sides.
I have another question.
Okay.
So, Dr. AK, since Joy is of childbearing, are there any maybe any precautions, maybe for choice of contraceptives or maybe pregnancy period? Thank you.
Thank you for that question.
Thank you for that
Dr.
question.
Eke?
Yeah, sorry. So yeah, that's a question we face a lot with women.
Yeah.
And what we do is we say that if you still want to have a child, you can. It will just require closer follow-up. And the team approach that Dr. Prem was talking about is very important in that. And so we can monitor the medicine you're taking. We can closely follow you up to make sure that there are no complications to your heart or to the baby. And there are many women who have had the surgery and also gone to give birth normal, to healthy children. So that's definitely possible. For contraception, we talk to people on an individual basis, but the two things we recommend is either the coil, or if you've decided you don't want to have children, then you'd have a ligation.
So it has to be non-hormonal?
Preferably, because we're giving you medicine to thin your blood, and unfortunately hormonal medicine, some types, can increase your chance of getting blood clots, and it can also affect blood pressure. Not to say that it can't be, but we have those discussions, and then on an individual basis, with the patient and the family, her husband, and everybody, then we come to a conclusion that fits best for them.
Maybe a question on that. Does she have to go through the blood thinning process and treatment for how long maybe?
Okay. So as long as you have a mechanical valve, and that's what we put into people, then you require blood thinning medicine lifelong. Okay. And that's to prevent clotting or clot forming on the valve.
Okay. Okay. Thank you so much for that, Daktari. Any other question behind you? You can start by saying your name.
My name is Melvin Acheng Masharia. Thank you so much for the opportunity. I happen to also be a student at the KTN Hospital. So I've encountered people actually getting to the age of 10 years with these congenital diseases. How do they thrive to that age?
The question goes to Dr. who?
To Dr. Prem.
Thank you, Melvin.
Tell me that question once again. I didn't hear the last part of it.
Okay, yes. I was
The
saying,
child is 10 years old.
yes, actually
Yes.
there are some of them who can reach to up to 10 years old with the congenital issues. And we just know the heart is the key. So how is it that it's possible for them to actually reach to that stage with such conditions?
Yeah. So I think for that, I think prevention is better than cure.
Okay.
That's my feeling. So that's why the school health program is very important. Screening the children at school will be the easy way to catch them when they have a problem. So I do talk to the teachers. It is more than the parents. Sometimes it is the teachers who detect that a child at school has a problem. You find that the child is not running around with other children or whatever it is, So I think educating the teachers, the parents is very important, because sometimes the child may not express what the problem is, but they can detect it. So as I rightly told you, repeated respiratory infection or the milestones are, child is not, one of the common complaints or one of the common things that parents come and say that he eats well, but he is not getting any weight. He just remains thin in comparison to other children of similar age.
Okay.
So not getting, loss of weight or not gaining weight, repeated respiratory infection, easy fatigability, he runs for a short distance, he has to sit or he gets tired.
And they go through this maybe for how many years?
No,
Like
that's what I mean. So these are the common problems that children have, and that's what the teacher or the parents detect, and that's how they bring it.
So
And
for the 10-year-old, like
yes,
she asked.
yeah, where the child cannot express it. Child doesn't know what's happening. He gets tired, he sits in one corner. So the parents or the teachers have to identify and catch the problem.
So for that 10-year-old, can they be cured just like Joy was?
You can. So the idea is that to investigate properly. Of course, now the science and technology has advanced. We have the tools to identify what is the problem. And as you know, echocardiography is one of the tools, non-invasive, whereby you can identify most of the problems without giving an injection or anything like that, or sedating or anything.
Okay.
So once you have the diagnosis, then you have the treatment. If you don't have the diagnosis, it's like shooting in the darkness. You don't know which way to go.
Sure.
So I think once you diagnose it, then there is a treatment option. As you know, in KTN Hospital, we do good number of children, more than 10 kilograms. That's what I say, not the age, 10 kg, then you can ask me, why you don't do less than 10 kg.
Yeah.
Children, if the weight is very low, they are very tricky. One number thing, the morbidity mortality is high.
Yes.
And then you need lot of expertise, as we rightly told that there is a separate new specialty like pediatric department has come up, cardiac department, and the ICU has to be very well equipped, things like that.
Yeah.
So we may be there in the years to come, in KTN Hospital, but not now. So if it's a very complex heart disease, less than 10 kilograms, you think that child has got very high risk. If you do a surgery or anything, then we refer to a higher center.
Okay.
But more than 10 kilograms, we do it. And as Dr. Anthony Gikonio has told, nowadays we are developing in KTN, we have the ways and means of fixing many of these issues without surgery.
Okay.
It's called minimally invasive, catheter based, whereby you put a tube through the groin into the heart and use technology to plug, like holes can be plugged without surgery, or an abnormal artery can be blocked with coils. So those things have developed. So many times the parents want that to be done, because of course no one would like to have a cut on the chest.
Definitely.
So the recovery is faster. In 2 or 3 days time, the child goes home back to normal health. So that is one speciality which is coming up,
Okay.
and the technology is developing, and fortunately it is being offered to the children.
That is good. Well answered. So we can take 2 more questions before winding up.
Thank you for this chance. My name is Bernadette Mburo. Maybe my question will be to Dr. AK. It's more on the reproductive. So a patient is supposed to be on blood thinners for life. Now my question is, will this affect the flow of a female, and can it affect it to an extent where the patient can have anemia? And how after, well, maybe if they have anemia, how do you manage it? Do you taper down the dose, or what is done? Yeah, thank you.
Yeah.
Thank you, Bernadette, for that one.
So another good question. So
Yes.
it's a challenge because we're thinning blood and it can affect the flow. And so we have to find a balance between supporting the heart and making sure the valve is functioning well, but not causing too much blood loss. And so that's where we again have the team approach, where we have the gynecologist involved, and then we find, is there a reason why your flow is more than it should be? So is it, say for example, fibroids? And if it is, then we'd refer you to a doctor who's an interventional radiologist, and the idea would be, rather than doing an open procedure, then we'd go and look at the blood vessels to the fibroids, block those, and hopefully that's the treatment. There would also be supplements like to boost the blood, and in certain cases then we also have to give blood transfusions.
Okay.
And then we also look at ways to decrease the dose just for maybe a day or two, just during the first day of the cycle, so that decreases the amount of blood loss during the course of the cycle. But again, it's a team approach, and it's something that a lot of people face challenges with, and it's our job as a team to resolve them.
Glory, currently you're on the thinners.
Yes.
Have they affected you, your menstrual cycle, or anyhow?
No, I have been lucky enough on
The
that.
flow has been normal?
It has been very normal.
Okay. What's
Yes.
the dose looking like? How many times do you take it in a day?
I take 5 mg
Uh-huh.
once a day in the evening.
Okay.
Yes.
Failure to reach? Maybe you skip a dose?
So we have long discussions with patients before, during, and
Yeah.
after, and during the clinics, and we explain to them that this is a very important medicine to take. We're all human. We may miss a dose or two, yeah, but the aim is just to be as consistent as you can be, because if the valve clots, then the results can be catastrophic.
Okay. Well understood. So let's take the last question.
My name is Trevor Chiang. I'm a medical student. So far, my question is to Dr. AK and Dr. Prem. So far, we have talked about the problems, and my question is for a solution. We know that there is the heart-to-heart program, but is the public more aware of the congenital? Like, for me, I was born with 6 months, and I thank God I don't have the congenital problem. But is the public more aware that this thing is inevitable, you know, for African culture?
Yes.
How do I put it? The myths and misconception, like the mother may refuse the child. So what's your advice to the public?
So thank you for that. It's a very good question. It goes back to the issue of awareness.
Yes.
And so you mentioned the Heart to Heart Foundation, which Dr. Prem has mentioned, which we've been running through the KTN Hospital, even before the hospital was there for the past 30 years. They've been running awareness programs for teachers, but and in general, they have a heart run and other activities during the year just to raise money for patients to get surgery, but also to raise awareness.
Okay.
We've started a training program for clinical officers, and they're there between nurses and doctors, and the whole idea is that we've given them skills to be able to diagnose these problems better, and so that when they go back to other parts of the country, then their ability for parents to reach them is high. We have the Kenya Cardiac Society under the leadership currently of Dr. Samir, and part of their function is to increase awareness not only for congenital heart disease, but just heart disease in normal. We have the government through the NCD and the NCD coalition, whose job is also to create awareness. But I think that's the main thing, and hopefully shows like this are creating awareness, because the more people know, then the easier it is for them to understand, and then we don't have issues of where now either the mother is rejected, the child is rejected, or people feel that there's something maybe like witchcraft that caused this to happen, and cause families to break up. And it also means that people are more likely to go see a doctor to get their condition diagnosed and are accepting of the treatment.
Okay. Thank you so much. Anything you have to add, Dr.
No,
Prim?
basically, what I want to tell you is that it is the awareness which make the people educated. You know, help is available. So many people, they still feel that there is no help available, that's the end of the road. No, this is not the end of the road. There is help available, you can take the help, and this is something which can be treated and cured. Many times, many of the diseases in children, when they come young, very young, it can be completely cured. I use the word cured because they become a normal, healthy citizens. But if you don't treat it and let the child grow to an adult, then there will be some changes within the heart. As we know, heart and the lungs, they, even though they are two organs, they work in tandem. You know, they work in very close collaboration. So anything happens to the heart on a long term, the lung also get affected. The pressure inside the lung goes up. So also if you have a chronic lung disease, on a long term, the heart gets affected. So they work in tandem. So these patients who have a congenital problem, which can be fixed very easily at a young age, if they miss it or they don't do it or they ignore it and they become an adult, some changes happens inside the heart and the lung. The pressure goes up, the muscles become thickened, the function becomes bad, it gets dilated. So those patients, even if you treat, they have to be on a long-term monitoring and medication. Sometimes in children, if you do it, they don't need any medication. They just run around and become a healthy citizen. So my advice to the public is that there is help available. The government is trying to help. KTN Hospital, through the Heart to Heart, is trying to do their part, you know, in whichever way we can help. So please get checked and treat it. It's better to treat early than to delay, you know. So nipping in the bud is the best thing.
Well said. And I'm sure most of the viewers right now have learnt a lot. A thing or two about the congenital heart disease. Thank you so much, Dr. Prim. Dr. AK. Now I'm leaving the set calling him Dr. AK, yeah? Thank you so much for coming, Glory. Thank you also for sharing your story. And to our audience, thank you for the questions as well. This has been Health and Wellness Show. If you have any questions, feel free to reach out to us on our socials at KTN Home. My socials are at Ali_Zaitun on Instagram and at Zaitun Ali on Facebook and Twitter. So holla and we will offer help, okay? So this has been Health and Wellness, and this is the Fairview Hotel. Thank you so much for tuning in.